Have you ever stopped to think that the small pill you take every day might be quietly affecting your brain health? Picture this. You've been taking a medication for years, believing it's helping you, only to find out it could actually be harming your cognitive function. Today, we're tackling an important, yet often overlooked topic: medications that may increase your risk of dementia. And before we begin, take a moment to subscribe and turn on the notification bell so you never miss practical, science-based guidance for protecting your mind and your body. Stay tuned as we reveal 10 common drugs linked to cognitive decline. Understanding these hidden risks could change the way you manage your health.
And make sure you watch until the end. Medication number 8 is the most surprising and the most widely used. Medication number 1, benzodiazepines. Benzodiazepines, such as Xanax and Valium, commonly prescribed for anxiety, insomnia, and stress-related conditions, have been linked to a higher risk of dementia. Medications like diazepam and lorazepam work by enhancing the activity of gamma-aminobutyric acid, or GABA, a neurotransmitter that calms the nervous system. While these drugs are effective for short-term relief, long-term use carries serious cognitive risk. Research shows that extended benzodiazepine use can interfere with normal brain function, potentially leading to memory loss and impaired thinking. For instance, a French study that followed more than 1,000 older adults over 15 years found that regular users of benzodiazepines faced a 60% higher risk of developing dementia compared to non-users. Dependence, both physical and psychological, can also develop, making it difficult to stop these medications without medical supervision. If you or someone you know relies on benzodiazepines, talk to your doctor about safer options. Cognitive behavioral therapy, or CBT, and other non-drug treatments can effectively manage anxiety and insomnia without posing the same risks. Any medication changes should always be guided by a healthcare professional to ensure a safe transition.
In light of these findings, it's vital for both patients and healthcare providers to carefully evaluate long-term benzodiazepine use, especially in older adults who are more vulnerable. Exploring alternative therapies can help protect memory, focus, and cognitive health while still managing symptoms effectively. If you're serious about keeping your brain safe, type SAFE in the comments. Let's see who's protecting their memory, starting today. Medication number 2, anticholinergics. Anticholinergic drugs such as atropine, hyoscyamine, mescalamine, and scopolamine are commonly used to treat allergies, urinary incontinence, and Parkinson's disease.
These medications work by blocking acetylcholine, a neurotransmitter that plays a crucial role in learning and memory. While effective for certain conditions, prolonged use has been shown to impair cognitive function. When acetylcholine activity is suppressed for too long, it can lead to memory problems and even increase the risk of dementia. A University of Washington study that tracked over 3,400 adults for 7 years found that people who regularly used anticholinergics had a 54% higher risk of developing dementia, especially those taking higher doses for extended periods. This is alarming because many people don't realize that even common allergy or sleep medications may fall into this category. Older adults, in particular, need to be aware of these potential side effects. If you use anticholinergics frequently,
it's important to talk to your healthcare provider. There are often safer alternatives, such as nasal corticosteroids, that can effectively treat allergies without the same cognitive risk. Protecting your brain starts with knowing what's in your medicine cabinet. Awareness and proactive choices can make a significant difference in long-term brain health. Medication number 3, opioid painkillers. Opioid painkillers like morphine and oxycodone are widely prescribed for managing severe pain after surgeries or for chronic conditions. These medications work by binding to receptors in the brain and spinal cord, effectively blocking pain signals. However, prolonged opioid use can cause more harm than most realize. Research indicates that long-term use may alter brain structure and function, leading to a reduction in gray matter volume, particularly in areas responsible for memory and decision-making. These changes can impair cognitive performance and increase the risk of dementia over time. A study published in the Annals of Internal Medicine found a strong link between long-term opioid use and a higher likelihood of developing dementia. Additionally, the sedative effects of opioids can cause drowsiness, confusion, and difficulty concentrating, worsening cognitive symptoms. So, what can you do if you depend on opioids for pain relief? The first step is to talk openly with your healthcare provider. Discuss potential risk to your brain health and explore alternative pain management options. These may include non-opioid medications, physical therapy, acupuncture, or mindfulness-based approaches, all of which can offer effective relief with fewer cognitive side effects. If opioids are necessary, use the lowest effective dose for the shortest possible time, under medical supervision. Regular monitoring can help catch side effects early and keep your brain sharp while managing pain. Balancing pain relief and mental clarity is essential, because true wellness means protecting both your body and your mind. Medication 4, Tricyclic antidepressants, TCAs. Tricyclic antidepressants, or TCAs, such as amitriptyline and nortriptyline, are primarily prescribed for depression, but they are also used to treat anxiety disorders, chronic pain, and insomnia. These medications work by increasing the levels of neurotransmitters like serotonin and norepinephrine in the brain, which help regulate mood. However, TCAs can have significant cognitive side effects, especially in older adults. While tricyclic antidepressants can be effective in improving mood and reducing symptoms of depression, it's also important to consider their potential impact on brain health. One of the main concerns with TCAs is their effect on cognitive function. Some individuals may experience drowsiness, confusion, or difficulty concentrating, and these effects tend to be more pronounced in older adults, as the aging brain becomes more sensitive to medication. The anticholinergic properties of TCAs, meaning they block the action of the neurotransmitter acetylcholine, which is vital for learning and memory, are partly responsible for these changes. This interference can lead to memory problems and, in some cases, increase the risk of developing dementia. Quick check: are these insights new to you? Type 1 if yes, or 0 if you'd like more videos on medication safety. Recent studies have found a link between long-term use of anticholinergic medications, including TCAs, and a higher likelihood of cognitive decline.
A study published in JAMA Internal Medicine reported that extended use of these drugs was associated with an elevated risk of dementia. This makes it crucial to carefully assess the ongoing need for TCAs, especially in older adults, and to explore alternative treatment options when possible. For those already taking TCAs, regular consultations with healthcare providers are essential. Discussing any noticeable cognitive changes with your doctor can lead to adjustments in dosage or even a switch to safer medications. In addition, non-drug therapies, such as cognitive behavioral therapy, or CBT, and lifestyle changes can effectively support mental health while minimizing risks to brain function. Number 5. Antipsychotics. Antipsychotic medications like haloperidol and risperidone are often prescribed to treat severe mental health conditions such as schizophrenia and bipolar disorder. These drugs work by altering the balance of neurotransmitters in the brain, particularly dopamine and serotonin, to help manage symptoms like hallucinations, delusions, and mood instability. While antipsychotics can be life-changing for those who need them, prolonged use has been linked to cognitive decline and an increased risk of dementia. Research indicates that these drugs may cause structural and functional changes in the brain, accelerating cognitive symptoms such as memory loss and impaired thinking. For instance, a study published in the British Medical Journal found that elderly patients on long-term antipsychotic therapy experienced a faster decline in cognitive function compared to those not taking these medications. Beyond cognitive effects, antipsychotics can also lead to sedation, tremors, weight gain, and diabetes, all of which can complicate both mental and physical health. If antipsychotics are medically necessary, close medical supervision is essential. Regular evaluations help doctors manage side effects, adjust dosages when needed, and ensure that treatment remains as safe and effective as possible. Number 6. H2 receptor blockers. H2 receptor blockers, also called H2 antagonists, are medications designed to reduce stomach acid. They are frequently used to treat gastroesophageal reflux disease, or GERD, ulcers, and other digestive issues. Common examples include ranitidine, famotidine, cimetidine, and nizatine. These drugs work by blocking histamine receptors in the stomach lining, lowering acid production. Although generally considered safe and effective, some research has raised concerns about their possible link to cognitive impairment, especially with long-term use among older adults. A few studies suggest that chronic use of H2 blockers might be associated with a higher risk of dementia, although findings remain inconclusive. Factors such as age, general health, and coexisting medical conditions may also contribute to these cognitive changes. If you regularly use H2 blockers, it's important to weigh the benefits against potential risk. Discuss your concerns with your healthcare provider. They can evaluate your specific situation and recommend safer or shorter-term alternatives if needed. To minimize risk, always use the lowest effective dose for the shortest necessary duration. Complementary lifestyle habits like dietary adjustments, maintaining a healthy weight, avoiding smoking and alcohol, and eating smaller meals can also help manage acid reflux naturally without relying heavily on medication. Number 7. Anti-epileptic drugs. Anti-epileptic medications, such as phenytoin and valproic acid,
are vital for managing seizures in individuals with epilepsy. They work by stabilizing electrical activity in the brain, preventing seizures, and improving quality of life. However, long-term use of these drugs has raised concerns regarding their effects on cognitive function, particularly memory and concentration. This is because anti-epileptics can disrupt neurotransmitter activity, which is essential for smooth communication between brain cells. Additionally, the sedative effects of many anti-epileptic medications can contribute to drowsiness and difficulty focusing, further worsening cognitive challenges. A notable study published in Neurology examined the long-term cognitive effects of anti-epileptic drugs and found that patients who used these medications for extended periods faced a significantly higher risk of developing dementia. The study also revealed that high doses were particularly concerning as they further increased the likelihood of cognitive decline. Despite these risks, anti-epileptic drugs remain an essential part of epilepsy treatment. If you're taking these medications, it's vital to work closely with your healthcare provider to monitor and manage potential side effects. Newer treatment options and combination therapies may offer similar seizure control with fewer cognitive drawbacks. Additionally, adjusting the dosage under medical guidance can help reduce side effects while maintaining effective seizure prevention. Number 8. Statins. Statins are widely prescribed to lower cholesterol levels and reduce the risk of heart disease, heart attacks, and strokes. Common examples include atorvastatin, also known as Lipitor, simvastatin or Zocor, and rosuvastatin, known as Crestor. These medications work by inhibiting an enzyme in the liver called HMG-CoA reductase, which plays a key role in cholesterol production. By lowering cholesterol, statins help prevent plaque buildup in the arteries and promote better cardiovascular health. While statins are generally effective and life-saving for many, concerns have emerged about their long-term impact on brain health. Some studies suggest that prolonged use of statins may be linked to memory issues or mild cognitive impairment. However, these effects are not universal. A study published in the Journal of the American College of Cardiology found that while some patients experienced minor memory problems, these symptoms were usually temporary and reversible. Overall, for individuals at high risk of cardiovascular disease, the benefits of statins often outweigh the potential cognitive side effects. Still, if you notice changes in memory, focus, or mental clarity while on statins, it's important to consult your healthcare provider. They can evaluate your symptoms, adjust your medication, or explore lifestyle-based alternatives to maintain both heart and brain health. Number 9. Proton pump inhibitors, PPIs. Have you ever taken proton pump inhibitors, or PPIs, like omeprazole, known as Prilosec, or esomeprazole, known as Nexium, for acid reflux or ulcers? While these drugs can provide tremendous relief, especially for chronic heartburn, studies now suggest that long-term use may pose hidden risks to brain health. PPIs work by blocking the proton pumps in your stomach lining that produce acid, easing discomfort and protecting the digestive tract from damage. However, when used continuously, PPIs can interfere with the absorption of key nutrients essential for brain health, such as vitamin B12 and magnesium. Deficiencies in these nutrients have been linked to memory problems and cognitive decline. In addition, Some research suggests PPIs may directly influence brain function, though the exact mechanisms remain unclear. A study published in the Journal of the American Geriatric Society followed over 1,000 older adults and found that those who used PPIs regularly had a higher risk of developing dementia compared to non-users. If you rely on PPIs to manage digestive issues, it's important to talk to your doctor about these potential risks. They may recommend alternative treatments, such as dietary adjustments, smaller meals, or less potent antacids, which can relieve symptoms without compromising brain health. Number 10. Hormonal contraceptives. Hormonal contraceptives, especially those that combine estrogen and progesterone, are among the most common medications used for birth control and menstrual regulation. They are also prescribed for conditions such as acne or hormonal imbalance. However, recent research suggests they may have subtle effects on cognitive function. These contraceptives work by adjusting hormone levels to prevent ovulation and maintain menstrual cycle control. Since estrogen and progesterone also play key roles in brain function, supporting memory, learning, and mood regulation, altering their levels for prolonged periods may affect brain performance. A study published in the Journal of Women's Health observed women who had used hormonal contraceptives for several years and found a slight decline in cognitive function compared to non-users. Although these results are preliminary, they raise valid concerns about long-term hormonal influence on the brain. It's important to note that the research is ongoing and not yet definitive. If you're using hormonal contraceptives and are concerned about their impact on your memory or mental clarity, speak with your healthcare provider. They can help you weigh the benefits and risks and explore non-hormonal alternatives if appropriate. Final reminder: medications can be life-changing and sometimes life-saving, but they may also carry hidden cognitive risk, especially with long-term use. Always consult your healthcare professional before making changes to your prescriptions. Protecting your brain health is just as important as managing physical symptoms. If this information helped you, remember to like this video, subscribe, and share it with others who might benefit. Stay informed, stay proactive, and most importantly, stay healthy.